Hi everyone, I'm here today with Bryan Thieme, who graduated from CWU in 2009, so towards the end of the recession there. He majored in psychology, got his minor in philosophy, and then went on to be a clinical neuropsychologist. So welcome, Bryan.
Hi, Jesse.
Hi, thanks for being here today.
Glad to be
All
here.
right, so I'm going to jump into the question. So how did you get the job that you have now?
It was a really long process going from the time I was at Central to where I'm at now. So in my final year of Central, I was really committed to going to grad school, and I know my role working with career services really helped get all my material together. Then it was grad school for 4 years, and then at the end of grad school and all the hoops you have to jump through with theses and dissertation. I completed an internship in Western New York at a VA medical center, followed by a residency, and it was a 2-year residency. And at about the start of my second year of residency, I was starting to look for work, and it was really important for me to get back to the Pacific Northwest. And was really fortunate that timing just aligned really well. And the job that I have now came available right when I started searching for jobs, and I was checking job boards constantly, like multiple times a day, seeing if anything new came up. And I applied for a few different jobs in the area and had multiple phone interviews, and then eventually my current employer was able to fly me out for in-person interviews, and the stars just really aligned for me, and was able to convince them to hire me.
Right on, good job. Okay, so can you take us through what a typical day looks like for you as a clinical neuropsychologist?
Sure. So in my role, primarily what I do is see patients to do really extensive cognitive and psychological evaluations. So on most days, I'm meeting with patients, and an evaluation typically consists of reviewing records, meeting with the patient to do a clinical interview. I'm getting background information from them, talking about their symptoms and talking about their concerns. But the majority of the work that I do with the patient is administering standardized tests looking at intelligence and reasoning and memory and different kinds of thinking skills. And with those tests, I compare their performance to healthy individuals who are similar to them. And that can sometimes tell us a little bit about their brain health. So it's really helpful for patients when there's a question of a neurologic condition, like a patient has Parkinson's disease, or they've had a traumatic brain injury, or they have epilepsy, or if there's concern for something like Alzheimer's disease starting. So we do really, really involved testing of people's higher order thinking skills. And then at the end of that, usually write up a report, talk with other medical professionals about the findings, and share those with the patient, and hopefully help the patient with treatment planning. But it's really, I get to see some really interesting patients, some really unusual neurologic conditions that you read about in textbooks, people who lose certain abilities, like losing the ability to speak, or they have memory problems, or problems inhibiting themselves. So I really enjoyed the work that I've been able to do working with people directly.
Wow, that's fascinating stuff. All right, what earlier jobs did you have in the field of psychology?
Before going to grad school, I was able to I had a summer job working in Yakima, actually, working with folks with dual diagnosis, chemical dependency, and mental health issues. And then as I got through grad school, most of my work was not paid. You're getting practicum experiences, providing therapy, and learning the basics of being able to do assessment. And during graduate school, I was able to make a little bit of income just working as a technician, administering some of the tests that I administer now. And then with internship and residency, it's kind of a graded process where you get more and more responsibility, and you get more and more kind of freedom in how you start practicing until you get to the point that you're able to practice independently. So I feel like I'm still really early in my career, and I'm still kind of developing the professional skill set, and kind of developing into more leadership roles moving forward is where I see things going, but it is kind of an evolving process.
Okay, wonderful. Thank you so much. All right. What skills and strengths do you think are the most important for someone to be successful in a role like yours?
I think there are a few things that are really critical, and there are a few things that are, I think, just good to have. And I think some of the things that I feel like I rely on the most is, even though I've practiced neuropsychology, I think you have to have a good foundation in being a psychologist, and that usually involves being empathic and being compassionate, and having a curiosity for people and for the way people behave and the way people live. I think for neuropsychology in particular, it's really important to try to communicate clearly and to be I feel like I spend a good bit of time writing, either writing to other professionals or, writing reports that will go into people's medical records. And I think it's important to be able to, in a really concise manner, communicate the way you're thinking, and to be able to kind of show your thinking clearly. And I think beyond that, having attention to detail really helps. Sometimes I'm called upon to make some really big decisions, and it takes really focusing on even small bits of information and making sure that you're providing adequate care to the information that you're getting, that can really make or break how good of an evaluation you do.
Okay, great. Thank you. In terms of advice, what advice do you have for someone who is thinking about going into this field?
I think it's important maybe I didn't appreciate it when I was getting into the field, it is a long process, that it's, there are a lot of steps along the way to ultimately get to being a clinical neuropsychologist. And so I think it's important to recognize that this is something that does take a lot of effort and a lot of time. You have to hopefully go into the field, passionate about what you want. So I guess overall, what I would say is that it's really important that you find a job that you love, something that really interests you and really inspires you, that makes you feel powerful, something that you feel like you can put a lot of time and effort into it, because some of these jobs, they do take a little time and a lot of effort to learn and to get really good at. So you got to be motivated to do it. And that's, I think, again, finding the thing that really inspires you, the thing that motivates you, makes the work a lot easier.
Oh, that's so great. Thank you so much, Bryan. I'm going to let you go now. So take care of yourself, and thanks for spending that time with us.
All right, take care.